Welcome to Dentalect, your favorite dental lecture series. Today, our topic will be on the principles of oral diagnosis and the process of arriving at a treatment plan. To begin with, the diagnostic process as such is begun by gathering information all about the patient and create a patient database which will help us to give us the future patient care decisions. Although each component is different and varied, each of it includes a very vital information that comes from by asking several questions towards the patient, reviewing the information on the forms and observing and examining structures, performing necessary diagnostic tests, and also consulting with fellow physicians and other previous dentists. Now, you must know the importance of oral diagnosis and treatment planning before jumping into the treatment. And before we get into the topic, you have to know a few terminologies. The first terminology that you must know is oral diagnosis. It's the art of using scientific knowledge to identify oral disease process and to distinguish one disease from another. The diagnosis of oral medicine. Now, this one is a very famous question during the examination. It's defined by the American Association of Oral Medicine as the specialty of dentistry concerned with the oral health care of medically compromised patients and with the diagnosis and non-surgical management of medically related disorders or conditions affecting the oral and maxillofacial region. Do go through this definition. And the final terminology that you ought to know is treatment planning. It's a schedule of procedures and appointments designed to restore step by step a patient's oral health. The plan contains the various advantages, disadvantages, costs, the treatment plan and the alternate treatment plan and the sequelae of the treatment. Now that you know the terminologies, you must know what is diagnosis. The word diagnosis means thorough knowledge and entails acquisition of data, and this is obtained using our senses. And to remember these senses, we use the famous mnemonic HOTS. H stands for hearing, meaning you're listening to the history and speech of the patient. O stands for observation, where you will observe for the patient's appearance and behavior. T stands for touching, where you will touch and feel for temperature and duration, maybe the consistency of whatever you're examining. And finally, and sometimes you will use the sense of smell in order to find out malodor. Several disorders can be identified with a type of malodor from the patient. Next terminology that you ought to know is signs and symptoms. It does look or feel similar, but it has a very big difference. Signs are commonly discovered by the dentist during the examination and it is called as objective finding. However, symptoms are verbally revealed by the patients themselves and usually because they are causing problems, and this is more of an objective finding. For example, if the practitioner observes swollen ankles and patient has difficulty in breathing while reclined, then this can be a suggestive finding of congestive heart failure. However, the patient's symptoms will be exhibited as pain, swelling or bleeding, something of this sort. So this is a major difference between signs and symptoms. So sign is objective and symptom is subjective. Now let's see about the components of oral diagnosis. There are 5 major components in oral diagnosis. The major 80% of the cases is diagnosed through history. A thorough history helps you to diagnose 80% of the cases, followed by physical examination and local examination. And based on the history and the examination, you can supplement in some cases through necessary investigations in order to establish a final diagnosis. Based on the diagnosis only, you can come to a suitable treatment plan. If you see that this has a specific order and you cannot mix up the order in order to formulate the best suitable treatment plan for your patient. While recording the patient's history, the primary objective is to identify all the relevant information. However, the patient might describe some non-contributory incidents in the history, and it's only a skilled physician who can provide a certain direction to the answers provided by the patient by using different types of questions. So you'll have to use a mixture or a variety of questions in your diagnostic interview. And this type of questions can be broadly classified as open-ended, closed-ended, and leading questions. Let me make it simple for you. Let's go one by one. So, open-ended questions. Say, for example, you have a new patient and you're just at the beginning of taking the history. The patient walks inside your clinic. You try to ease their problems by asking the first question, a very simple and a very open question. Why have you come to the dental office today? What has brought you to the clinic today? Something as open as this facilitates the patient to talk as much as they need. And then, when you feel that they are trailing off a bit, perhaps going away from the history, and little unwanted information has begun into the history, then you can help the patient by obtaining specific information. The questions can limit the patient to answer in a single sentence or a single word. For example, all right, you told me that you have come here for a sensitive teeth. Is it going to be while taking cold foods or hot foods? Now, the sensitive teeth is getting aggravated by cold or hot. The patient's answer would either be cold or hot. So this is called as a closed-ended questions in order to obtain a specific information. And finally, we have the leading questions. These type of questions have an answer within the question. They help in bringing out a response from a very unresponsive patient and thereby winning the confidence of suspecting patients. Let me give you an example. Suppose a front tooth is broken. You, as a clinician, can ask the patient, so I presume that you had an accident and perhaps that's how you broke your tooth. This will help to build a kind of confidence in patients towards the clinician. Now moving over to the general physical examination and local examination. For the general health of the patient, it forms a very important step in arriving the diagnosis and formulating the dental plan. The general health of the patient can help the oral physician to understand the nature of the patient's present illness. We also have the extraoral examination, that is examining the head and neck region and making note of all the gross abnormalities, and the intraoral examination, which involves examining structures within the oral cavity. In order to establish the diagnosis, you will have to have a systematic correlation of the data from the history through the general physical examination, the extraoral and intraoral examination, and finally correlating these with the investigative report. Now, you've taken the complete history, run a few investigations, and you finally have a diagnosis. Based on the diagnosis, you will have a sequential planning of the treatments that you're about to execute. And this is called as phases of treatment planning. There are 5 phases in treatment planning as follows: systemic phase, acute phase, disease control phase, definitive phase, and maintenance phase. Let's break it down one by one. So in systemic phase, it involves a thorough evaluation of patient's general health history, any procedures that might need necessary management of the general conditions, the psychological health before venturing into the dental treatment. And the treatments that are included in the systemic phases are such as the antibiotic prophylaxis, perhaps the patient is a cardiac patient, stress and fear management, avoidance of certain medications or maybe products and patient has certain allergies, and any other precautions necessary to deliver treatment safely to patients who has serious health problems. So basically all the medically compromised patients will come under this phase, and each patient is unique. The second phase is the acute phase, and the sole purpose of this phase is to resolve any symptoms that the patient is presenting with, and these are usually pain, swelling, infection, or broken teeth and missing restorations. The treatments that are included in the acute phase are extractions, endodontic therapy, initial periodontal therapy, placement of temporary or permanent restorations, and repair of prosthesis. Moving on to the third phase. Now that we have addressed to the systemic and acute phase, we are going to try and control the active oral disease and infection and stop any aesthetic deterioration and manage the factors that can cause these oral problems. And the success and failure of a disease control phase is evaluated with a post-treatment assessment examination before proceeding with a definitive treatment option. And the treatments that are included in this disease control phase are oral hygiene instructions, scaling, root planing, caries risk assessment and prevention, endodontic therapy, and extraction of hopeless teeth and operative treatment to eradicate dental caries. Now that we have the disease in control, we can move over to a definitive prosthetic, orthodontic, or aesthetic rehabilitation just to do the rehabilitation of the patient's oral conditions and includes procedures that improve the appearance and function. For example, it can include additional periodontal treatment, including periodontal surgery, orthodontic treatment and occlusal therapy, oral surgery and pre-prosthetic surgeries and orthognathic surgeries, elective endodontic surgeries, single tooth restorations, replacement of missing teeth with fixed or removable prosthesis, and any other cosmetic or aesthetic procedures fall under this definitive treatment phase, which is all about rehabilitation of patient's oral condition. Whatever the phases are, whatever the treatments are, without maintenance and follow-up, it is all doomed to fail. So, patient has to be periodically reevaluated and followed up in order to provide supportive care and maintain all the procedures that have been done so far. So, the maintenance phase procedures can include periodic examinations, periodontal maintenance, application of fluoride, and oral hygiene instruction re-emphasis. Now that we have all the phases of treatment plan laid out to us, let's recall the importance of making a diagnosis. So whatever we've been speaking so far was to gather information through a thorough patient history and then do a proper physical examination, including the extraoral examination, intraoral examination, and based on the history and the examination, you post required investigations and in order to establish a diagnosis. Once you have a diagnosis, you will formulate a treatment plan and then execute the treatment. So this is the perfect pathway to reach your perfect diagnosis. These are a few terminologies that you're expected to know when it comes to diagnosis. A clinical diagnosis is made solely from history and examination. A pathological diagnosis is provided from histopathological results. And a direct diagnosis is observed by observing pathognomonic features. For example, if I say that this patient has Wickham striae, it means it's a pathognomonic feature of oral lichen planus. And then we have a provisional or a working diagnosis, which is an initial diagnosis which is made following which the investigations can be planned. And then we have the deductive diagnosis, which is made after due considerations of all the facts from history, examination, and investigation, one by deduction. Say even a leukoplakia diagnosis is more of a deductive diagnosis. We have a differential diagnosis, which is given for every diagnosis that you make. It is diagnosis that is considered by the similarities and the differences between other similar conditions to your current patient. And then we have the diagnosis by exclusion, which is identification of a disease by excluding all the possible causes. And we have the diagnosis ex juventibus, which is made on the response to a treatment. So if there is atypical conditions such as atypical facial pain, all that you can do is give various medications, various groups or families of medications, and try and see which works on the patient and based on which you give the diagnosis. You have the last one, which is the provocative diagnosis, not commonly used in dentistry. It is the diagnosis based on induction of the disease or condition in order to establish the diagnosis. The best example is allergy testing. Now that you know all about the history, examination, diagnosis, and the treatment planning, we'll have to not forget about the prognosis. What is prognosis? It is meaning foreknowing or foreseeing. It's a medical term that's used to describe the likely outcome of an illness. Unless you know the prognosis of this particular case, there is no point in trying to do an invasive treatment and it's going to fail. So determining the prognosis before jumping into the treatment always ensures 95% clinical success in your patients. So far, as a dental student or a dentist, you have learned how to take a good history, how to examine the patient, perform necessary investigation, arrive at a diagnosis, and formulate a treatment plan, and based on the prognosis, how to execute the treatment in order to achieve success. Now, I'm going to talk about general clinical guidelines or etiquettes to follow as a dentist while examining the patients in a dental office. Let's see one by one. First and foremost, greet the patient and always check you have the correct file of the patient, and this can be ensured by cross-checking the name of the patient, his age and address. it is always advisable to have an attending with the patient. However, all the communication needs to be done with the patient, and only if the patient consents, you can share the information with the bystander. And this all goes with the HIPAA rules. Third is positioning the dental chair as much as possible comfortable for the patient, and also taking care of your ergonomics as a dentist. And special care needs to be taken if they are medically compromised, such as spinal disorders or perhaps a pregnant woman. The fourth and important point is that the oral physician should be seated on the right of the patient, facing the patient, and maintain a warm and dignified atmosphere. And the next point is that exhibiting empathetic interest in the patient's systemic and oral health, and make sure that you are maintaining eye contact and control your facial expressions, and do not be judgmental or impatient with the patient's problem. And promote the ability to try to view from the patient's perspective or patient's viewpoint, and use simple vocabulary while you're talking with the patient, and do not use any special slangs, medical terms or jargons as far as possible. Whenever there is a language barrier, feel free to use an interpreter, and make sure that both the clinician and the patient are on the same page. And always examine the patient under sufficient light, and follow the universal precautions of care: the gloves, the masks, and clean sterile equipments. Make sure to drape the patient and avoid placing the instrument tray or the instruments over the patient's chest, which is not considered appropriate at all. And also, it is difficult to position yourself around the patient, but try as much as possible not to rest your arms or hands around the patient's shoulder, and maintain a comfortable distance with the patient. Ensure the diagnosis of the disease is always revealed to the patient in an empathetic manner, and only if the patient consents, you can give the information to the patient's attender. Now that you know the clinical etiquettes, this is a short case history performer which you can go through the way how we record a patient's history in detail. We have the demographic data, which includes the patient's identification number, the name, age, gender, occupation, and address. We have the chief complaint, history of presenting illness, past medical history, dental history, and personal history, and we have the family history. These are the general physical examination findings, and then we have the extraoral findings and intraoral findings. And intraoral, we have specifically the hard tissue and soft tissue examination. These are the points to be noted while you're examining a specific lesion, for example, a red lesion, white lesion, perhaps an ulcer or a swelling. Ensure to note down these points while you're examining each type of lesion. With this, we are wrapping up for the day. I hope you understood, and if in case you have any doubts, feel free to comment below. I will try as much as possible to answer all of your questions. And as a dentist, this is the most vital topic that you must know, the first topic that you must know while you're examining the patient. When it comes to your examination point of view, the entire chapter, you have specific questions on the terminologies, the various types of diagnosis, and you have the specific questions on open-ended, closed-ended questions. So these are something which is vital when it comes to an examination or MCQ point of view. So thank you for listening.